Okay, good afternoon, everybody. I will start the topic on Shuang Hor personal care product, which is called Greenzhi Toothgel. We always call this product 小兵立大功 in Chinese, small soldier but gain huge credit. As a Greenzhi Toothgel is a very good quality product, which with lower dollar value at $6 member price. So it's easy to introduce this product to new prospect. Of course, this product is a very special as it is fluoride and triclosan free toothgel in the market, but still can maintain the important function of fluoride in the toothpaste product. Okay, let me explain what and why. Okay, Greenzhi Toothgel achieving sparkling white teeth and fresh breath. Let us start with dental and oral health. Dental and oral health is an essential part of your overall health and well-being. And you have this poor oral hygiene can lead to dental cavity and gum disease. I will explain to you what's cavities and gum disease, and has also linked to heart disease, cancer, and diabetic. So it's kind of serious. Maintaining healthy teeth and gums is a lifelong commitment because we have teeth and gum, right? The earlier you learn proper oral hygiene habits, such as brushing, flossing, and limiting your sugar intake. People know that sugar actually will cause more acidic and it will actually cause cavities. The easier it will be to avoid costly dental procedure and long-term health issue. In Singapore, I noticed that, I'm not sure do you all see, dental cost is getting higher and higher. So I don't know why this happened. And let's understand some facts about dental and oral health. I'm going to present you some example of our dental and oral diseases. But before that, let's talk about facts. Dental cavity and gum disease are common according to WHO. Between 60 to 90% of school children have at least one dental cavity. Nearly 100% of adults have at least one dental cavity. I'm not sure anybody don't have dental cavity here. If yes, if not, congratulations. Between 15% and 20% of adults aged 35 to 44 have severe gum disease. I'll mention what is all this gum disease. Above 30% of people around the world aged 65 to 74 don't have any natural teeth left. Most likely have to wear denture. In most countries, out of every 100,000 people, there are between 1 and 10 cases of oral cancer. So oral hygiene and all these cavity problem at a very low percentage might lead to oral cancer. This for information. So the burden of oral disease is much higher in poor and disadvantaged population group where dental or oral hygienics tend to be less in that kind of population. So people might deprive a chance to see dental on their health of gum or even teeth problem. So let me move on to explain to you some type of the dental and oral diseases. Number one, cavities. Cavity in simple term is tooth decay. Tooth that have been permanently damaged and may even have a hole in it. Okay, so that is the tooth decay. So why this happen? They occur when bacteria, food, and acid coat your teeth and form a plaque. You can see from this. This is a very healthy tooth. This one where you have this plaque forming because of bacteria, food, and acid coat. And you eat away the animal, and even to the dentin. Then you will go into the very near to the connective tissue. Over time, this can lead to permanent damage. This one not so bad. If you can have detect earlier, people can dental just do a filling. So straightforward. Number two, gum disease or gingivitis. This is quite a common problem and it's a very headache problem. It's an inflammation of the gum. Can you see this? It means that there is an inflammation on all the gum. The result of plaque building up in your teeth due to poor brushing and flossing habits. And this plaque collect on teeth, it hardened into tartar and also called dental calculus. So this is an image of the calculus, and this one is how the inflammation happen, the area of inflammation happen, and it might cause pain. And this gingivitis can make your gums swell and bleed when you brush or floss. I'm not sure do you have this kind of experience. Yes, you may want to see your dental. Untreated gingivitis can lead to a periodontitis, a more serious infection. What is periodontitis? Periodontitis is actually a more severe form of gingivitis. Periodontitis progresses, the infection can spread to your jaw and bones. Remember, that's how our inflammation is happen only on the gum area. But if this thing getting serious, it will spread to your jaw and bones. It can also cause an inflammatory response throughout your body. So I think that's what we don't want to see. Okay. Next is a cracked or broken teeth. A tooth can crack or break from an injury to the mouth. Some people like to eat maybe a peanut, like to eat certain nut that's very hard. And chewing hard food or grinding of the teeth at night. Another group of people will have this cracked or broken teeth. They are actually having grinding the teeth, so-called habit at night. A cracked tooth can be very painful. Okay, so let's move on to look at sensitive teeth. You may feel pain or discomfort after having cold or hot food beverages. So can you see? You drink something hot or you drink something cold, you'll feel the kind of pain sensation. And this can be a result of gum disease. Residing gum means getting thin gums, or cracked tooth. You have feeling but already worn down, or you have a crowning already worn down. And some people naturally have a sensitive teeth because they have thinner enamel. So this is very common. That is a kind of depend on the person. Naturally, sensitive teeth can be treated with a change of daily oral hygiene regimen, and you can opt for certain type of toothpaste and mouthwash that can reduce this sensitive teeth problem. Last one, as I mentioned, this one we don't want to see, oral cancer. This type of oral cancer include cancer in the gum, tongue, lips, cheek, floor of the mouth, hard and soft palate. Palate is actually, you can see this one is at the behind of our mouth. And this is normally due to the tobacco use, such as smoking and chewing tobacco is a bigger risk factor for oral cancer. And the betel nut chewing in certain countries like Myanmar, that also can lead to very high oral cancer type. Okay, so we move on to the toothpaste. Toothpaste basic. Okay, so let's understand from the toothpaste and what is a common ingredient used in the toothpaste. Okay, abrasive agent. So this is important. This agent to add to a toothpaste. So it's a scratchy material, help remove food, bacteria, and some stain from your teeth. Flavoring. Okay, we have to add some flavoring to the toothpaste because that will make the toothpaste taste better. Although we don't swallow it, but you know that our gum actually have all the taste bud. I don't think you want to use a toothpaste that is no flavor, bitter flavor, am I right? Normally they use artificial sweetener include mint, are often added to toothpaste to make them taste better, as I mentioned earlier. And they also added moisture retentions, contains substances like glycerol to prevent toothpaste from drying out. Because toothpaste is keeping in the tube, you might use it for weeks to months. So you want it to be a more dilute form, am I right? So that to have certain things to maintain the moisture, make sure that don't dry so easily. Thickness, add thickness to the toothpaste because we want to put the toothpaste in our toothbrush. If you just imagine, if you don't have, if it's not thick, the tooth, you'll not be called toothpaste. You'll be maybe called tooth water or whatever. Detergent, and this one is actually want to take away the the so-called the after washing the wastewater from your teeth. So you have this SLS type. Fluoride, this is a very important ingredient, make tooth animals stronger and less likely to suffer acid damage. Reverse the early stage of acid damage by remineralizing area and that have started to decay. So most of the toothpaste contain fluoride, which is very important. But we have some standard warning on the fluoride. If you go and see the toothpaste selling in the market being started with the D or started with the C, you always see this warning. Use a smaller size amount and supervising brushing to minimize swallowing. In case intake of fluoride from other source, consult a dentist and doctor. So this warning is always on the toothpaste packaging in case you don't see it. Fluoride is very important. It protects the teeth from decay, but too much fluoride actually will lead to dental fluorosis or poisoning of the fluoride. That's what it means. But fluoride is very important. You cannot use a toothpaste without fluoride unless you added some other ingredient to do it. That's why I'm going to introduce a toothpaste very special. It's fluoride free, and actually, and you still can do the job of fluoride. And for information, certain group in US classified fluoride as a carcinogenic, cause cancer. But this warning normally apply for children, especially they may be accidentally going to swallow it. Let me introduce our product Greenzhi Toothgel. Toothgel with natural composition, mild action, and non-toxic and safe to use. Function and benefits. It contains Lingzhi or Ganoderma. So if we understand, Triterpenoids in Lingzhi are exceptional in subdued glucan that will prevent dental plaque or decay. And the other component, polysaccharide, enhance blood circulation in gum tissue that will prevent gum problem. Neem extract, this is very rare on other toothpaste, but we have it. The function of the neem extract is whitening the teeth, protect the gum, and avoid ulcer. This why it's very good. Reduce inflammation of mouth cavity due to tooth decay. So this one, neem extract, is a plant-based product. So it starts to act like a fluoride function. Another function is a new ingredient to our Greenzhi Toothgel we call Gayu Shuji or miswak. It's a natural extract from a tree, and it has been widely used by Arab ancient by whitening and polishing teeth and act as a natural toothgel to promote oral hygiene. So I think in the market, not many people will use all these plant-based type, but I think I really appreciate that. Aloe vera, I think this is important. Reduce inflammation, kill bacteria, and repair cellular tissue. I think this can sort of replace also function of fluoride. Xylitol, reduce dental plaque. Okay, also can reduce function of fluoride. Natural gel is important because when you brush your teeth, you need to have you want to reduce the friction of the brush that causes damage to the enamel. So it's reduce friction. Okay, and also have component like foaming agent. Okay, foaming agent is important because you want to have a proper washing and bring out the waste later. And our foaming agent is coconut and corn, able to subdue bacteria and prevent tooth decay. And that's the reason we don't need to use fluoride and other type of chemical foaming agent. Chlorophyll, prevent of gum bleeding, sensitive gum, and bad breath. Break down food debris usually stuck in between the teeth, subduing the dental plaque. I think this is always our headache where we don't want to have the natural peppermint. As I mentioned, we need to have certain flavor to the toothgel, keep the mouth cavity fresh without irritation. So why Greenzhi Toothgel? Because it's natural ingredient, as I mentioned, there's no fluoride, there's no triclosan. It's all natural ingredient, and it's suitable for all family members. I always mention that when you have if you have kids who start brushing the teeth, you better use this. You know why? Even the kid accidentally swallow it, you also don't need to be worried about fluoride poisoning. Who should use? As I mentioned, suitable for everybody, including children, people who have sensitive teeth, breathing gum, bad breath, and all adults. And these two gels are very interesting because it contain aloe vera and green tea. They actually you can do a small remedy. You can apply if they have minor burns or insect bite. Okay. And how to use? Gargling your mouth with water. Do not brush with excessive force to prevent you from scratching too much from the animal. Wash out with water after brushing. Okay, this is a standard method of brushing teeth. And I want to give a summary page of what our toothpaste use. Okay, so gum protection. Our Greenzhi Toothgel can have enhanced blood circulating in the gum tissue, prevent gum bleeding and sensitive gum. I think this is very important. Most of people who use this will have seen their sensitive gum issue reduced. Teeth protection, prevent dental plaque decay, whiten the teeth, reduce friction and avoid damage to the animal when we're brushing teeth, subdue bacteria and prevent tooth decay, break down food debris usually stuck in between the teeth. And your mouth, about the mouth cavity, avoid ulcer, reduce inflammation, kill bacteria and repair cellular tissue, prevent bad breath, keep the mouth cavity fresh without irritation. So if you look at these charts, actually our Greenzhi Toothgel give an overall protection in our oral hygiene in terms of gum, teeth, and mouth cavity. And most importantly is contain more natural ingredients. So I always urge everybody, you should try our toothpaste. So as I mentioned, it's a healthy and natural formulation for you and your whole family members.